The federal government has expressed confidence in South Australia's ability to deal with the latest coronavirus cluster and says Defence Force resources have been offered to the state. 17 COVID-19 cases have now been identified in Adelaide's northern suburbs. Health Minister Greg Hunt says he's been briefed by the Acting Chief Medical Officer and the National Incident Centre.
Their advice is that the system in South Australia is strong. We are standing up the National Incident Centre contact tracing capability to assist South Australia. We have offered them the ADF, and if more is required, more will be provided. But these are the sorts of challenges that if we trade or engage with the world, if we bring Australians home, we will face in a world where there's over 500,000 cases a day, and having these strong testing, tracing and isolation systems are absolutely critical, and South Australia, on all the evidence, does have exactly that.
And so Adelaide's new coronavirus cluster has prompted new border restrictions for anyone arriving in WA from South Australia. Passengers on one flight from Adelaide to Perth found out they had to self-quarantine just when they landed.
It's making me pretty nervous, actually. So there's some talk around the airport maybe they might need a quarantine now that they've come in. So my mum's only come for 2 weeks.
We're just kind of feeling pretty miserable for her. She hasn't met Dylan yet, and it's been a long sort of 7-8 month wait for her.
Didn't know when we left. Obviously it was announced when we arrived.
Oh, it was pretty devastating. Yeah, absolutely.
Some South Australians there arriving in Perth yesterday, just the ongoing challenges we're facing here in Australia with the coronavirus situation. Dr. Emma Miller is an epidemiologist at Flinders University and she joins us now from Adelaide. Emma Miller, welcome. So is it too much to expect that Australia can develop a hotel quarantine setup that does not end up with a breach and getting into the general community? Is this just too virulent to expect that?
I think that it's not so much the virulence of the virus, but just the sheer force of it coming from overseas. So, if you think about this as a global phenomenon, which it is, we're on a big wave upwards. We have a huge pressure of virus coming into the country. It's not a question of whether we can keep it out, but whether we can control things once they happen, when they come in. And Australia has done a very good job at this, and particularly South Australia has. This is an example of what it means to live in a world that's having a pandemic and that everyone's susceptible to. So hopefully, was obviously a wake-up call. Hopefully we'll have the systems in place that are strong enough to take care of these sporadic outbreaks. So in answer to your question, it is too much to hope that we can have a completely watertight, airtight system for quarantine for incoming passengers.
And just go into a bit more detail for us as to why that's the case. Would it be possible to set up, instead of, having like hotels in CBDs, some set up like in the Northern Territory at the Howard Springs facility there, where people are at a mining camp or something like that? And so if there was that kind of setup, would it be more possible, would there be a greater possibility that the virus, any incidents of the virus cases among those people could be contained within that facility and not find their way into the general community?
There's no such thing as no risk. So it's clear that probably a system where people are completely removed from everybody else would obviously be less likely to have leakage than places that are situated in the CBD, as in this case and as in Melbourne's case. But the fact is that there's just so much of this virus out there. The risk, there's no such thing as no risk. There have been cases where, for instance, where people have had much longer incubation periods than expected. So then the question becomes, how can we make sure that we can identify those people and make sure that they are not passing the virus, even though they've actually passed through what's known as the safe quarantine period?
And so what can you tell us about the quarantine setup there in South Australia? Are they using private security guards, which was the big issue in Victoria? What's the setup with the people that
I'm actually not particularly sure about that, right, being an academic communicable disease epidemiologist. But I know that we do have a very, very strong contact tracing system. The fact that we've been able to get onto this so quickly and be able to track down the transmission pathways as quickly as we have is testament to that. So I think that we have a number of hotels in South Australia. This particular one is in the CBD. I'm not sure exactly what the setup in regard to security is, but clearly there has been an infection. This is a very strong epidemiological link to that particular hotel. We haven't got any of the genomic information back to confirm that, but I think there's absolutely no question epidemiologically that's where it came from.
And talk us through what you know about the timeline of this so far. You talk about you've got great confidence in the contact tracing system there because they've got onto this really quickly. Is it clear how long it was between when the virus got from a person returning from overseas to someone working in the facility and then when it first started getting into the community, or that's not clear at this stage?
I think we're pretty clear. I mean, this is obviously the ongoing work that's been done at the moment, and I probably don't know an awful lot more than what is reported in the media in that respect. But I understand that the outbreak probably started with someone returning from overseas at a particular inner city Medi Hotel. From there, it went to the worker there, who then introduced the virus to a woman in her 80s. The partner's mother, she was symptomatic for a couple of days from the 12th and was tested positive on the 14th. And since then, there's been a cascade of events, including involving contact tracing. In an abundance of caution, several centres have been shut down, including a Hungry Jack's in the northern area, a primary and preschool in the northern area, and I think also the Plaza shopping centre. So there are a lot of people that are potentially at Parafield and Parafield Plaza shopping centre, and there are a number of people that are potentially exposed. But the big problem that we have here is that many of the people that are confirmed cases actually work in highly high risk areas, including Medi hotels, aged care centres, healthcare centres, including a major northern area hospital, a major prison in South Australia, also in the northern areas, which obviously contains a highly vulnerable population. And so there's potentially only hundreds exposed in the northern suburbs. And every care is being taken to make sure that we're taking this very seriously, and that it's caution plus. And I think the school's closed down for 24 hours as well for deep cleaning as well, because one of the students had a close contact with a case, but actually hasn't been confirmed with the case. So, I mean, this is the public health system swinging into action. It shows every signs of looking like a very strong public health system swinging into action. There's abundance of caution being paid to this outbreak because of the potential exposures in lots of vulnerable venues, and we can just hope that it doesn't get away from us. But this is the nature of the beast. This is a very infectious virus. Everyone is susceptible to it. We have very vulnerable communities that can be exposed at this stage, and fingers crossed we're going to get on top of it. But this is the nature of living in a worldwide pandemic.
Yeah, when you heard those occupations listed and the links to those different centres, did you think, gee, it couldn't get much worse in terms of where this kind of small number of people actually work? But yeah, you've got faith in the ability of the contact tracing system to get on top of it as quickly as possible.
Well, I have faith that we're as well placed as we can be. Right. So I don't necessarily want to say that this is all over, don't worry about it, we've got it in hand. I think it's a very scary situation, but if anybody can get on top of this, the system that we have in place can.
Yeah. And do you think the state government should take a look at the quarantine setup now in terms of its ability to take in the numbers of people that it is? Should that be cut down at all now, considering what's happened?
I think that it's too early to say that. I think that we have to start with the premise that we are always going to have issues with returning travellers, with cargo workers coming into the country while we have a worldwide pandemic going on. Yeah. So the best thing we can do at the moment is really make sure that we have the strongest public health systems that can address these issues when they arise. It's very unlikely that we won't have this sort of thing happen again and again while this is going on and before we get a vaccine.
Yeah, and at least there's so much optimism about getting a vaccine now. Are you one of those who's pretty optimistic that there will be one at the latest by the new year?
I'm probably on the more sceptical side. I think that really in the there may or may not be a vaccine. I don't think it will be that early. My best guess, all things going well, is that we might have one readily available to people by the end of next year. Wow. But in the meantime, the best thing we can do is to keep up those basic practices, maintaining distances, not going to work if you're ill, getting tested as soon as you feel any symptoms, making sure that you're wearing a mask if you're in an area that simply cannot be, where social distancing isn't possible. These are wash your hands regularly. These are the things, basic things we can do, and we know that they work. Just looking at what's happened with our general environment in regard to respiratory illnesses all through winter. We did have a lot of people vaccinating for flu, but generally we've had very few respiratory illnesses all up because people are actually being observing those sort of basic hygiene practices more than usual. So it goes to show that with vigilance, we can try and keep ourselves safe, and we can make sure that we have a well-supported and well-resourced public health system. Then there's no reason why we can't sort of stomp on these outbreaks as they occur and stay safe in the meantime.
Yeah, and maybe that trend of people being more attentive to hygiene will last for many years after this pandemic, and we'll see fewer incidences of flu in the general population for years to come. Okay, Emma, thanks so much for talking to us. It's been really good having a chat to you this morning in Adelaide.
Thank you.